A new study finds a steep drop in how moms are rating their own mental and physical health, raising new concerns about the pressures many parents are facing. Our chief medical correspondent, Dr. Tara Narula, is going to break it down for us. So the researchers found that 1 in 12 mothers, both biological and adoptive, were saying they were having these challenges. And this slide happened before the pandemic. So is there a reason here?
Yeah, this is so important. So for any moms out there right now, put your coffee down and take a listen. This was a survey of 200,000 moms who were basically mothers to kids 0 to 17 years old from 2016 to 2023. They asked them about their physical health and mental health. And most of them reported some decline in their physical health. But what was really astounding is what you said, that there was a large proportion that noted a drop in their mental health over that time period. Those who had reported excellent mental health, that number dropped by about 12 percentage points over the time frame. And those who had reported poor or fair mental health, that number increased by about 3.5%. So what is going on here? We know that in August of 2024, the former Surgeon General, Vivek Murthy, released an advisory saying that parents are under pressure, that parental mental well-being and health is a crisis in this country that needs immediate attention. In addition to that, let's talk about the fact that maternal mental health is the leading cause of maternal mortality after pregnancy. 23% of women are dying in this country from maternal mental health conditions. So the landscape here is probably 3 issues really going on. One is we have a lack of access to mental health care. I have patients telling me they're waiting months to see somebody in a therapy office. The cost is really prohibitive for many, and it's just hard to get attached or connected with someone. The second issue, we don't invest in women's health in this country. I work at a hospital system where we have at the Katz Institute for Women's Health. That should be the norm everywhere, where we're studying, researching, understanding women and their health conditions, not the exception. And the third issue, which is really when you look at what women are juggling, so financial pressures, worrying about their kids' physical and mental health, taking care of their kids and elderly parents and their jobs, navigating this new world of social media and tech, maybe feeling socially isolated and alone. You put that all together and it is just the perfect storm. No wonder we have a mental health crisis.
I'm so glad we're talking about this, and not just about the physical aspects, but the mental aspects and how you can have this conversation now. So women who are feeling like they're just so overwhelmed right now, what can they do to protect their mental well-being?
Yeah, and it's not just about women. Obviously, we worry about the effects on the moms, their physical and mental health, but there is a ripple effect on children, right? So the mother's mental health affects the development, the physical and emotional health of the child. So it is important that women prioritize their mental health, right? So we talk about putting on the oxygen mask in the airplane. This is so important. We have to get rid of the mom guilt. So I hear so many women, myself included, who say, I can't take an hour out of my day away from my kids to do things like exercise or take a walk or focus on my sleep or maybe meet with friends because we feel guilty, right? That has to move up on our priority list. We think about boundaries. We have to set boundaries. We can't say yes to everything. And finally, self-love and compassion and grace, right? We are not forgiving of ourselves. We can't be at every game. We can't make everything right all the time. We fail sometimes as parents, and guess what? That's okay. Our kids need to see that we're not perfect either.
We need to do more on this.
Yeah,
we've got to do more.
Yeah, we need to continue this because we talk a lot now about, postpartum depression.
Right.
We don't talk about all the years afterwards.
Got it. Yeah. Thank you, Dr. Narula. Appreciate that so much.